Hello, my name is Dr. Dewan S. Raja. Today I will discuss about hyperparathyroidism. What is hyperparathyroidism? There is the excessive function of the parathyroid gland. This is a common endocrine disorder characterized by overactivity of the parathyroid glands leading to increased level of parathyroid hormone in the blood. So levels of the parathyroid hormone will be high. The parathyroid glands are four small glands located behind the thyroid gland in the neck. Their primary function is to regulate calcium and phosphorus level in the body. Phosphorus means phosphate here. Hyperparathyroidism causes extreme osteoclastic activity in the bone, which enables the calcium ion concentration which elevates the calcium ion concentration in the extracellular fluid, while usually depressing the concentration of phosphate ion because of the increased renal excretion of phosphate. Primary hyperparathyroidism. The cause of primary hyperparathyroidism usually a benign tumor, adenoma of one of the parathyroid glands. It may be parathyroid hyperplasia on rare occasion, around 5% cases. About 1% cases it may be a cancer of one of the parathyroid gland. So common cause is benign adenoma. Okay, such tumors occur much more frequently in women than in men and children. Why? Because pregnancy and lactation stimulate the parathyroid glands and therefore predispose to the development of such a tumor. Adenoma causes the affected gland to produce excessive amount of parathyroid hormone. Adenoma is the cause of primary hyperparathyroidism in around 95% cases, leading to elevated levels of calcium in the blood that is the hypercalcemia. Hypercalcemia can lead to various symptoms including fatigue, weakness, bone pain, kidney stone, and digestive issues. We'll go there. There may be peptic ulcer, even pancreatitis. Secondary hyperparathyroidism. This type usually a response to low level of calcium in the body, often due to chronic kidney disease. In secondary hyperparathyroidism, the parathyroid glands become overactive in individuals with kidney problem and is often associated with disturbance in calcium and phosphorus metabolism. Secondary hyperparathyroidism can be caused by vitamin D deficiency or chronic renal disease in which damaged kidneys are unable to produce sufficient amount of active form of vitamin D125 dihydroxycholecalciferol. Okay, so that is secondary hyperparathyroidism, can be caused by vitamin D deficiency or chronic renal disease. We have another term, tertiary hyperparathyroidism. In minority of patients, parathyroid activity may become autonomous and excessive, with resultant hypercalcemia, a process termed tertiary hyperparathyroidism. We have to go through the genetics of hyperparathyroidism. While the majority of cases of hyperparathyroidism are sporadic, non-inherited, there are some genetic factors like cyclin D1 gene rearrangement and MAN mutation. MAN stands for multiple endocrine neoplasia, are associated with this condition. On rare, there is the minority group. Mostly it is a sporadic adenoma of particular one of the parathyroid gland, but it may be go through, this is may not be sporadic, it may be there is some particular genetic factor like this and that. Okay, so we have the cyclin D1 gene generator, cyclin D1 gene rearrangement. We already discussed that. Okay, so we got that. Okay, so we discussed that. Okay, so we got the multiple endocrine neoplasia 1, multiple endocrine neoplasia type 2, will get parathyroid hyperplasia. Okay, in this situation, hyperparathyroidism, jaw tumor syndrome, especially seen in children, and there may be tumor of the mandible or maxilla, maybe in the kidney, even in the urinary bladder. So this may be associated with hyperparathyroidism. Familial hypocalciuric hypercalcemia is a rare autosomal dominant disorder caused by loss of function mutation in the parathyroid calcium sensing receptor gene, which result in decreased sensitivity to extracellular calcium. So that is the familial hypocalciuric hypercalcemia. Symptoms of hyperparathyroidism: fatigue, muscle weakness, depression of CNS and PNS. CNS means central nervous system, peripheral nervous system, bone pain or tenderness, kidney stones, frequent urination, peptic ulcer, abdominal pain, anorexia, distaste for food, nausea, vomiting and constipation, depressed relaxation of the heart during diastole. Hyperparathyroidism can at times cause the plasma calcium level to rise to 12 to 15 milligram per 100 ml and rarely even higher. So we got another parameter, hyperparathyroidism, and calcium level should be 12 to 15. Even it may be higher than that. Okay, this is the thyroid gland. These are 1, 2, 3, 4 parathyroid gland. It is shown here, seems to be anterior, but it is behind the thyroid gland. This behind thyroid gland, that behind thyroid gland. Now we have just discussed key learning signs of hypercalcemia due to hyperparathyroidism. There will be hypercalcemia. We will have painful bone, renal stone, abdominal groin, pain in the abdomen, sitting on the tree, okay, like polyuria and constipation, sitting on the throne, not tree, throne, there are like that of polyuria and constipation. And certainly psychiatric overtones in a patient who has a patient of hyperparathyroidism. Okay, now I'll go to the diagnosis and treatment. Okay, we got that. Okay, so we got the signs, symptoms here. We'll go to the diagnosis and treatment. Blood tests are conducted to measure the calcium and parathyroid hormone level. Imaging studies such as ultrasound, CT scan, and scan, okay, systemic scan may be used to locate abnormal parathyroid gland. Surgery to remove the overactive gland Parathyroidectomy is often the primary treatment for primary hyperparathyroidism. In some cases, medication may not be used to manage the symptom and lower calcium levels. Untreated hyperparathyroidism can lead to complications such as osteoporosis, kidney stone, and kidney damage. Let's get some highlights. Primary hyperparathyroidism is the most common cause of asymptomatic hypercalcemia. In a majority of the cases, primary hyperparathyroidism is caused by sporadic parathyroid adenoma and less commonly by the parathyroid hyperplasia. Okay. Parathyroid adenoma are solitary while hyperplasia typically are multiglandular process. Skeletal manifestation of hyperparathyroidism include bone resorption, osteoitis fibrosa, cystica, and brown tumors. Renal changes include nephrolithiasis, there's kidney stone, and nephrocalcinosis. It may be anywhere, not only in the kidney, maybe in the bladder also. They may have stone, even in the urethra. Clinical manifestation of hyperparathyroidism have been clinically summarized as painful bone, renal stone, abdominal groin, and psychic moans. Secondary hyperparathyroidism most often caused by renal failure, which lowers the serum calcium levels, resulting in reactive hyperplasia of the parathyroid glands. Malignancy are most important cause of symptomatic hypercalcemia, which result from osteolytic metastasis or release of parathyroid hormone related protein from non-parathyroid tumor. And that's all about the hyperparathyroidism. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.